patients that snore heavily or have sleep apnea are at real risks of having other systemic disease problems with their bodies. So it's really important to be able to breathe well so that you can stay well rested, to become well rested. And sleep apnea treatments are complex. Some people just can't wear a CPAP machine. Sometimes they're uncomfortable, the hoses and the masks are difficult to position correctly. And depending on the situation, we can actually help provide oral solutions to reduce or eliminate sleep apnea as well. Patients who've been diagnosed with sleep apnea but maybe have failed on a CPAP, there are alternative options. And one of those options is a mandibular advancement splint. It's almost like a retainer that goes in the mouth that kind of repositions the lower jaw forward enough that it pulls the tongue away from the back of the throat and opens the airway, allowing the patient to breathe naturally. So there are two real reasons that we would potentially use that. One is they've tried a CPAP and failed on it for whatever reason. They just can't use a CPAP. They weren't able to adapt to it. And their sleep physician decides, hey, something's better than nothing. And so getting an oral sleep appliance will help to reduce the symptoms of oral sleep apnea. Maybe we even completely eliminate it, but even if we could reduce someone from a severe to a mild apneic, or we could go from a moderate to no sleep apnea, is a significant change. The other option is sometimes patients who are on CPAPs, but the CPAP has to be turned up so far that it actually makes it difficult to use. So if we combine oral sleep apnea therapy with a CPAP, we can turn down the pressures. And so it makes the CPAP wear more comfortable for the patient as well. So we actually have some patients who will do both and really go from poor sleep, headaches in the mornings, difficulty staying asleep, whatever it might be, to something where they can get through a night and feel well rested when they wake up.